Gauteng Education Department again asking for parents to sign consent forms for their children to be vaccinated against measles. From the start of the year, there have been over 500 cases of measles. The Gauteng Education Department trying to stop it from spreading. Jack Manamela is an epidemiologist at the National Institute for Communicable Diseases. Jack, good afternoon to you and thank you for your time. We know measles is one of the most infectious diseases there is. How quickly is it spreading in Gauteng at the moment?
Good afternoon, Stephen and the viewers. It has been spreading very quickly currently in Gauteng province, affecting mostly the three metros, city of Johannesburg, city of Tshwane and Ekurhuleni metro. But there are also cases that have been detected in Silveng district and Western district. And it's affecting ages that are different. And in Gauteng, we also see what we have never seen before with some cases in adult cases.
Where are the adult cases coming from? It's quite rare for measles to do that, isn't it?
Yes, it's something that is rare that we are not used to. But they are coming from different parts of the province. And we have seen some sporadic adult cases also in some parts of the country, which is a concern.
I mean, obviously, it's concerning if adults get measles, but we know that many members of our communities come together in schools. They're often the centre of a community. If we were able to get all the children vaccinated at schools, I presume that would help to stop this epidemic from spreading.
Yes, that will reduce the spreading of the disease because if we increase the immunity in schools, we're not only protecting the children of school-going age, but we are protecting the parents, we are protecting our communities, and we also protect whoever that comes in contact with, including during social and when we go to the religious meetings. Basically, we are protecting the whole community.
Most of the children in the Gauteng education system now would have been in the Gauteng education system when they were younger, and they would have, I presume, been vaccinated then. Do you need a new vaccine as a child? Do you need more than one vaccine against measles?
With measles, usually it's recommended that a child get 2 measles doses to be fully protected. But we know that even 1 dose is protective, but with 2 doses, we have a higher protection. And the challenge currently is that in the metros, we have pockets of areas where there's high number of children that even never received a single dose of those vaccine, or some they received only 1 dose of vaccine, which reduces the protection of those children and also reduces the immunity coverage of the vaccine in the areas that we usually see a high number of cases reported.
Okay, so would you, I mean, in normal circumstances, would you be vaccinating older children, say over the age of 10, even if they've been vaccinated before, or are we revaccinating children just because of this outbreak?
Usually we are guided by the measles surveillance data because in some instances you'll find that the measles outbreak, it affects the children under 5 and the measles vaccination campaign will be done in the children under 5 regardless of their vaccination for 2 doses. It will be just to make sure that even those that had 1 dose, they have a booster dose. But in these instances, because majority of the population that were affected is children 1 to 15 months, 15 years. The surveillance data guided the decision that the recommendations for vaccination should be children from 6 months to those who are 15 years old. By doing that, you cover a broader range of children that have not been vaccinated. This will include some of the children that missed their vaccination during the COVID period.
Okay, I mean, I realise that for various reasons, some children do miss it. What I'm trying to get to is that if a child has been already vaccinated twice, is it dangerous to be vaccinated for a 3rd time, or does it not matter?
No, it doesn't matter. What it happens is that it will just boost your immune system to be even more effective in terms of protecting against the measles virus infection.
Okay, and are there any risks with a measles vaccination? I know we've been vaccinating people against measles. I mean, I think probably my grandparents would have been vaccinated against measles, so we're going back a long way.
There are no risks. The measles vaccine has been shown to be very safe and effective in protecting people who are vaccinated. And it is important to vaccinate because by vaccinating, we're protecting the population against severe disease, severe complications that might happen, such as brain infection of the brain covering, which usually they will say a person has encephalitis, and also pneumonia, and some in children, they will have severe diarrhea, which sometimes end up with dehydration, and that might end up in death in those young children under 5. So by vaccinating, regardless of how many doses they have, it protects them, and it also makes sure that we prevent those complications and deaths in especially children under 5.
So this is the thing, is that I think, a lot of people see measles as just a normal childhood disease. It can actually be very serious.
Yes, the diseases can be very serious. And the concern is that when we see it in older age group, also like adults, and they will also complain of severe headaches and other diseases that I just mentioned, that it might end up with encephalitis and pneumonia. But in adults, those who are immunocompromised might be more affected. So even though the government currently, the vaccination coverage, the vaccination target is those under 5. Some of the adults, they can still get the vaccine, even though they will have to pay for it, which is also available in private sector pharmacies like Discam and Clicks.
Okay, so, I mean, obviously we want to vaccinate as quickly as we can. We want to get as many people vaccinated. Is the current measles epidemic that you're looking at, that you're following as an epidemiologist, is it behaving in the way that a measles epidemic normally behaves? I know I think it's called a very high R number. In other words, it is incredibly infectious. But is it moving in the way that you would expect it to, or is there anything different about this epidemic?
Stephen, according to our observation, is what is expected, because if we get challenges like the one that you just mentioned just now, that some of the parents are not signing the forms for giving permission for their children to be vaccinated. The measles, we know that in a population with high people that are susceptible to measles, meaning that they are prone to measles infection because they don't have immunity, we know that it can, one case can infect between 11 and 18 people. And the other challenge with measles is that a person who has measles, if he's in a room and leave the room, the measles can also be there for up to 2 hours. So basically, this is what happens if the actions that are needed for intervention, such as vaccinating high population quickly to prevent the spread of that disease, it will happen. And in this case, usually because the spread, we started seeing it in young children, and the Department of Health usually what they will do is, even if there's one case, they'll do contact tracing, follow all the contacts, and then give them the vaccine to prevent more cases. Regardless of the age of the contact, they will give that measles dose even as a booster dose. So, but with these challenges of people who are not allowing the Department of Health to give their children the vaccines, and even when they do contact tracing, when some refuses the vaccines, they allow the disease to spread quickly, and that should be expected.
So, I mean, this is the issue we see in our society, but in other places too. more and more epidemics of measles. There's one underway in parts of the United States right now, partly because parents just haven't vaccinated their children or haven't allowed them to be vaccinated.
True, Stephen. I think that is the thing that we should work with the communities and make awareness in the communities to let them understand that sometimes our actions as the community are the ones that makes the disease to spread faster. But if we act and work with the relevant stakeholders, that needs to protect us during the interventions that are needed, such as vaccination, because measles, the most effective way of preventing it is through vaccination. Then the government will look like as if it's failing. But if we work together with them, we can prevent this measles outbreak together.
Jack Manamela, thanks very much indeed, epidemiologist at the National Institute for Communicable Diseases.